Hello, folks. Let's jump right into the topic living with severe back pain and how to navigate around it. I'll give you a little bit of history. I have made some notes so that I stay on topic and don't deviate too much. So, on a personal note, I developed L5 disc rupture back in 2015. So, it's been over 10 years now. and when it started back then, the lack of information was the main problem. I tried to find out the reason why it was happening, why I was having so much pain. But sadly, the medical system is quite flawed. The doctors don't have any interest in diagnosing you. They will just give you some painkillers, and if it's too much, they will just suggest go for a surgery. And so in the initial phase, for me, it was quite difficult to even find out what the problem was. Many doctors suggested, recommended X-rays. I went for X-rays, nothing came out. They said everything is fine. But it's such a stupid thing, right? Muscle tears cannot be caught by X-ray. You have to you have to go for MRI, and the doctors didn't even tell me to go for MRI. So that kind of knowledge gap was there. Thankfully, today, with YouTube and social media and people sharing their stories on various websites like Reddit, we know that the right ways, what kind of things you have to do. So today, I'll just talk about this thing and how we can navigate around it. And if anyone is going through such a extreme back pain and they're feeling hopeless about it, maybe this discussion might help them a bit. So, okay, let's talk about the stages of treatment. So, let's say today suddenly you developed a very severe back pain and you can hardly walk, and you're clueless what to do. My first suggestion would be, since we don't exactly know what the situation is, uh, get immediate medical help, get the MRIs done, and I would suggest that seek advice from multiple doctors, because most of the time many of the doctors are quite busy. They will not take any personal interest in you. So uh, and since uh, back pain, with all its complexity, it's still quite a simple thing. So you can just seek multiple advice, and you can even tell the other doctor that, okay, this doctor told me about this. So like that, chances are the doctors will suggest recommend you some painkillers and some physiotherapy sessions. It's good enough for the beginning, especially the painkillers. As we all know that these are not good for the long term. So uh, if the pain is severe, go for it for a few days. But I would suggest don't get addicted to them. Don't make the painkiller part of your life. And the physiotherapy, uh, when the injury is extreme in the beginning, whatever kind of at this stage, I would recommend, don't do your self treatment. Let the medical professionals get you back to a decent stage from where you can do your own thing. Now once that extreme pain session is over, the thing about medical science, the modern medical science, is it is interested in uh, treating to the point where there is a severe issue, severe pain. But once that is done, the long term health of a person is not the concern of medical professionals. You can They will give you a fix, they will give you a band-aid, but uh, they will not teach you how to maintain your diet, how to improve your body. Every time you go there with a pain, they will find a solution for that, but they will not give you a long-term solution. So this long-term sustenance is what I'm going to talk about today. But before going for the long-term solutions, let's look at some of the mistakes that people make. um, proper diagnosis. One of the things I talked about is the X-ray versus the MRI. I mean, if you X-rays can catch a fracture, it will not catch a muscle tear. It will not catch a disc slip or like a disc rupture. So uh, get the correct diagnosis. Also check other markers like uric acid. That also causes back issues, knee issues, pain in different joints. And then, as I mentioned, don't be shy to visit multiple doctors, get their opinions, and get the initial, the initial stages of treatment if the pain is extreme. And then another mistake is I would suggest is don't rush into surgery, even if your doctor says so. I mean, if the situation is pretty extreme, of course, you might have to go for surgery. But what I've observed is in most cases, people don't require surgery. So, I mean, take opinions from multiple doctors, professionals, good doctors. And if it's avoidable, it's better. That's what I feel, at least. Then another mistake is once your pain subsides a little bit, you rush into heavy workouts. I would suggest get a proper rest, let the body recover. You don't want to make the situation worse. So your workout, your workout would come. That's what I'll talk about. But hold on it for a while. Let the pain subside. Let your body get to a normal. And then dependence on painkillers, I already said. Mm, try to not become dependent on them. All right. Long-term solution. So one of the most important things would be developing a mindset, because till the moment you didn't have any such problems, life was going easy. You didn't even think about all these things. You would, and if you are someone who is into health, you worked out, you enjoyed it, but then suddenly this back pain comes and you live with pain every day. You can't push yourself the way you used to, before this thing happened. So things have changed now, and sooner you accept the reality, that's the better. And accepting the reality will not make the thing worse. It's just that you will develop a perspective. Um, you will learn to live with the pain without, without feeling so despondent that it affects your psyche every day. No, you will realize that, things happen to people. And that saying, why do bad things happen to people? And the answer is something on the lines of good things and bad things happen to everyone. It's how you react to them. So yeah, uh, accept the reality, build a strong mindset, and we'll find ways to navigate around it. But don't expect things to go back to normal. Not that fast. Maybe in a while. All right. Bring bring changes in your life, especially in the initial days. If you lift heavy objects, please avoid that for a while. Uh, any kind of physically straining activities, long walks, bike rides, long distance driving. I know in some cases these are a bit difficult to avoid, but reduce them as much as possible. Bring these changes in life. This is also part of accepting the reality. Then, but still, I would recommend that stay active, do a little bit of work. Don't lie in your bed all day and be depressed. And i- if it's possible, try to take a walk. Maybe cycle a bit if it's not causing too much pain. And even when it comes to workout, grab like a 2 kg dumbbells and just do a little bit of workout so that you get you feel that at least I'm doing something. But don't overstretch yourself in the beginning. Um, then, of course, gradually you'll have to increase your workout intensity, but that will come later. Okay. Uh, then what? Let's talk about the forms of exercises. Let's say couple of months from this thing. Now you have gone through the treatment. You have had your painkillers. You've attended your physio sessions. Now you're feeling slightly better, but it's not 100% all right. You still have the pain. but you feel like, yeah, I can do some exercise now. You might be confused, like, what should I do? Should I go for weight training? Should I, go for yoga, physiotherapy, stretchings? Uh, the way I did it was I tried everything in moderation, and I mixed it all up. And because some people have the tendency to go weight training heavy, or some people are like 100% into yoga. In this situation, I would suggest divide up your week into different workouts and see which ones give you better relief. And I mean, try it out. Try a little bit of cycling, try a little bit of weight training, light weights, uh, try some yoga, some stretching. And I think this goes even for not only for people with back pain, it goes for everyone, I feel. Different forms of exercises bring, activate different muscles, and the body reacts to it. New exercises, the body reacts well, and you feel fresher. So, yep, yep. Try to enjoy the workout. So, yeah, of course, maybe you were someone who never worked out, or maybe someone who did a lot, and then now you can't do the things like you used to. My advice would be whatever exercises you take on, the new things, the yoga, the cardio, the Zumba, whatever, try to enjoy them as well. See, these exercises are well renowned, done all over the world. All of these have a lot of value. So instead of just doing it like, this is a shit exercise, I'm just doing I'm just doing it because I have no other way. If you take that approach, you'll not feel enthusiastic about them. So try to enjoy these exercises, and also appreciate their value that they're bringing to your body and health. And once you enjoy them, you'll be able to push it, you'll be able to see the differences. Okay, some of the common scenarios. Let's talk about some of the common scenarios that happens to people, and uh, how to navigate around them. So what many people do is, yep, they try one form of exercise, and their pain exacerbates, and they decide, I can't work out anymore, I can't exercise. The thing is, it is the exercises which will strengthen your body, and of course the doctors, the painkillers, the physiotherapy will relieve your pain. But when you get back into normal life, and that pain, if you don't strengthen your body, those that pain will return, because most of this pain happens when these are the pressure points, where the stress in the lower back region, the L5, L6, this is the center of gravity. This is where all your body's pressure points accumulate on. And when you go back into your normal life, you walk, you do your exercises. If your the rest of your body muscles are not strong enough to give support to those points, that pain will come back. So you need to strengthen your body, not just the back area. You need to strengthen your arms, the core, um, the hips, the pelvic. And when you strengthen these various muscle groups, you can almost think of it like a bridge. It's yeah, the bridge, the road must be strong, but even the support, the hinges, everything has to be strong. So you have to strengthen your body. So just because of this accident, this lower back pain, if you decide that it's too risky, I'm not gonna work out, I'll just try to avoid the pain. Trust me, the pain will return, and most of the time it returns worse. So find exercises, and if one particular exercise you feel is not good for you, let's say for me, cycling worked great. I Because initially I was really struggling with weight training and running. With running, I was getting problems in the knee. With weight training, I did not know weight training that well. I didn't have a trainer, so I was very scared of that. But then I started cycling, and cycling worked great for me. Even after like cycling 40, 50 kilometers, I did not develop any back pain. So I use that to strengthen my body. So cycling is amazing. Whatever works for you. It can be Pilates, it can be yoga. Give it a try. If one form of exercise doesn't work for you, don't give up on, I mean, you can stop on that, but try something else. uh, in that, weight training is, I will say, is the most important, because it is only through weight training, strength training, that your muscles will be built up. But yeah, initially you might not be able to jump on it, so take it slow. You can, and uh, it will also be great if you can afford to get a trainer, because I would not recommend to train with just anyone or yourself if you are not familiar with weight training. But and keep it safe. You can do it at home. Just get very light dumbbells, 2.5 kg dumbbells, and try various exercises, find stretchings. In Instagram, you can find a lot of reels teaching exercises related to hip, glute, pelvic, all core. So all those you can do, strengthen your body. Uh, then some people, they stick, they, since the doctors show them the physiotherapy, the stretching and yoga, they only stick to it. No, man, you have to slowly transition into weight training. If you have to choose one exercise for long-term health sustenance with lower back pain, it is weight training. So no matter if you don't like it, you'll have to find a way to come into it. You have to learn it, find a trainer, learn yourself, get into a program, whatever it is. Weight training is what will save you. Uh, Going into a vegetarian diet. Yeah, horrible idea. Yeah, if you have back pain. So in my case, it was a back pain combined with a uric acid problem. Yes, uric acid, you know, red meat is not advisable. Inflammations happen. But the thing is, long-term vegetarian food is not good. You you can't get enough protein from plants. So in the initial stages, if you have been, if you feel light, you feel good, and you feel like vegetarian is good, okay, maybe a few weeks, that's all right. But please don't cancel out all the good non-veg food. Like, at least, and if you don't feel like eating any meat, at least eat eggs. At least eat daily 3 4 eggs. It has good absorbability. Take some whey proteins. Basically, get your proteins. That's how you will build up your strength, the muscles. All right. Another scenario, chiropractors. Will Can chiro help? I never went to a chiro. I was tempted. I wouldn't mind, but the thing is, chiro is quite expensive, and it's more of a boogie science. I've heard of internal injuries, and even if it's good, it's more like a massage, and I feel like it will only give you temporary relief, when the main solution for any kind of joint back pain is always strengthening your core and your body muscles, your structure. So any so even when it comes to massage therapy, chiro, yeah, they will improve your blood flow a little bit. They will open up the knots in, like the pain areas. But it's I will not call it long term sustenance. You can go, you can, if the pain is bothering you too much, you can go and get some relief out of it. um but then spending such big amounts, because I know the Cairo people have their own way of billing people, and the bills go up crazy. So not my, not something I would do. Yeah, what if you were intense workout guy? Yeah, maybe you were a power lifter, and like in gym you pushed to high intensities, you did big squats. Sadly for you, I would not recommend jumping into such extreme weight training workouts anywhere before a year. Once your disc rupture or L5, L6 region problem starts, if you push yourself to the extreme, these things will come back. So I don't know if you're like a professional athlete, professional power lifter. I don't know how they navigate around it. Do they give up? I mean, that sounds sad, right? Giving up your career because of a back problem. But then sometimes we have to pivot in life. Maybe you don't pursue that, maybe you pursue something else. I mean, it totally depends on the person. Maybe you do better in some other category. I mean, let's just give an example, like instead of a power lifter, you became an arm wrestler, something like that. I don't know, man. It's up to you. But I'm not saying that you can never be a power lifter, but a sport like powerlifting takes great toll on the body. And if you already have an issue in the, the main, the core, the main foundational structure of your body, I don't know if that would be recommended, because the workout that I am suggesting is uh, you know um, of a lesser intensity, slowly building up the muscle. So slowly strengthen up the muscle. So for a power lifter who already has that kind of strong muscle, I don't know what the solution is. Not my area. Maybe you need to refer like a sports athlete. They will be they can provide a better advice here. And last but not the least, prepare for the worst. Yep. So if you have a lower back issue, and it's kind of severe, and you can have a slip disc any moment. I mean, be prepared for it. Have some numbers of the doctors. Let your friends know that this kind of thing might happen. In case that happens, this is where you need to take me. Because see, back pain injuries, they can be mild pain, and sometimes it goes to super extreme where people can't even walk. And uh, in my case, it happened once that I fell flat on the floor and I could not move. So you really need to be prepared for such a situation. Have your medical emergencies ready, so that you don't have to scramble at the last moment. And so so th- so today I just like discussed some scenarios, some ways to how deal with the back problem. I didn't talk about any specific solutions. I talked more from a situational perspective. Maybe I'll make a second video where once I get some feedback from the people, they'll be able to tell me what exactly I need to talk about, since this is my first video. And as you can see, I'm not the smoothest around it, but nevertheless, I wanted to share my pain, the journey of my pain. And even my own story has a lot to it. So maybe someday I will talk about the things I went through, how it affected my career, my relationships, my life. It changed my life, to be honest. And however, after over now it's been over 10 years, I'm living with the problem. But it doesn't bother me as much as it used to. I don't limp anymore. I used to limp. And I work out regularly. I do weight training, strength training, stretching, uh, walking, long distance walking, and active lifestyle, you will say. um, I will not call myself 100% fit. I do sometimes enjoy a little bit of drink here and there. In those and in those like situations, I end up even smoking a bit. But nevertheless, I never thought that I would be able to control my pain and lead an active lifestyle. I thought that was not possible. And maybe in another video, I'll talk about the hardships that I went through. Not today. I'll wrap it up here. Shoot down your, it's a new channel. I'll react to people. I will respond to people. And if you have any questions, I'm always there. I'm not a medical professional. I don't have, I can't give you medical advice here. But as a friend, I have anecdotal things, and maybe I'm able to provide a path which is useful to you. And again, when it comes to back problem, different people get different sort of problems. Some have herniation, some have totally different uric acid related, some have joint issues. So it's not a one size fits all solution. But then the kind of things that I went through and how I found my way back into a healthy lifestyle, I think that's also a story which will help a lot of people. So, yep, that's it for today. And thanks for watching this, my first video. And I don't want to only make videos on back pain. I want to make videos on other uh, things in life. Be it career, be it other topics, things that millennials would love to have discussions about. So, upcoming days, I will think of those as well, and we'll try to be more regular. All right, signing off.